How are we doing? Yeah. Can we ready? Hi everybody. Today we are going to be doing a new infant exam on baby Rayleigh. She is 6 months old and as cute as can be. We do new patient infant exams on babies just to make sure that their range of motion is good, to kind of make sure they're meeting their developmental milestones, and to kind of address any segmental or somatic dysfunction that the baby might be experiencing. Oh my goodness, you're so cute. So the first thing that we're gonna do is I'm just gonna, as you can see, she's very calm here. I'm just taking a look at her, seeing kind of posturally how she's looking. Are her hips kind of tilted one way? Is her body kind of tilted or rotated one way? And how is her neck? So is she looking one way? Is she looking the other way? Mama's over there, so she's looking a little bit to the right, but I can already kind of notice that she has a preference for that left side. I've also talked to Mama just to make sure and address any questions she had before we started today so that we can address that during today's appointment. So the first thing we're gonna do is we're gonna check range of motion. So I'm just gonna be making sure that her shoulders are able to move. Yeah. We want to make sure that they're symmetrical and they're moving smoothly, as well as her elbows and her hands and her wrists. We're just going to check the grip reflex right here, and as you can see, she's grabbing on both sides. Next, we're going to go down to her hips and make sure that her hips are moving. This is super important to make sure that we're screening for any sort of hip dysplasia that might be present in babies. We're going to be checking her knees and her ankles and her toes. Her toes. Once I get down to toes, I like to check the Babinski reflex. What this is screening for is any sort of neurological problem within the central nervous system. In babies, can I take off her sock? We're going to take off your sock. So in babies, when I kind of touch her foot here, as you can see, her toes fan out, and that's a normal reflex for babies under the ages of 2. This is opposite in adults. I'm gonna just put this back on, or you wanna hold it? You wanna hold it? Okay. So next what I'm gonna check is her sacrum. What I'm gonna be doing is seeing, is one side higher than the other? Does the top of her sacrum feel like it's pushed up? And I'm just going to, so here on baby, I feel like her left side is a little bit higher than her right. So I'm just gonna be holding a sustained pressure here. The baby adjustment is very different than an adult adjustment. And what we do is we just hold the pressure on that bone or joint that we wanna move in the direction that we want it to move. And we just let baby do the rest. Good. While I'm here, I'm also gonna be checking her tailbone, making sure that's okay. What do you think? So I'm just gonna hold it here until I feel like it releases. What do you think, Missy? Good. And then next, I'm also going to check her dural tone as well as her hip mobility. So I'm gonna just bring her legs over to one side. And what I'm looking for is to make sure that her shoulder blades aren't coming up off of the table. And then we're gonna do the other side. So just like a little twist. Good. And so while I'm here, I'm also just gonna check her clavicles. I'm sure they're okay because she's 6 months old, but in newborns, we wanna make sure that there's no fracture in her clavicle because that is a common area to be fractured post-birth. Hers feel good. I'm also gonna check her diaphragm. The diaphragm is the main muscle that is controlling breathing, so it's super important that baby is breathing evenly on both sides and that we're not feeling any sort of adhesions or any sort of trigger points within that. She feels really good. Oh, she's smiling. So next what I'm gonna do is I'm gonna flip her over. And I'm gonna be checking her thoracic spine. So I'm just gonna be placing her over me here. So we're noticing a few things here. First thing is that she's able to keep her head up, which is super healthy. Oh no. And here I'm just gonna be palpating her back here and seeing if I can feel any area that's restricted. So I kind of feel an area right here. So I'm gonna put her back. Okay. Okay, here you go. And then I'm just gonna put my hands behind her back, and it's kind of like a little stretch. So I'm gonna be finding that area. So as you can see, right when I put my hands on it, she got a little fussy. She's smiling now. Oh, so I know kind of I'm on that right spot. And I'm gonna kind of work my hands up, kind of stretching out that back. Oh, you got your sock on her face, girly. What do you see? Okay, so we're gonna flip her around, and next we're gonna be checking her cervical spine and her neck. Oh, hi. So here what we wanna do is we're just gonna put her head, we're gonna turn it one way, we're gonna turn it the other way, just very, very gently, and seeing if she likes going to one side versus the other. So that side was good. I'm gonna try going to the left. Okay, let's go to the left. There we go. Okay, so both sides feel pretty good. And now so I'm gonna put my hands under her neck, and I'm just gonna be feeling, and it's just very light pressure. What do you think? Do you like it? Do you like it? Yeah. Okay, good. And I'm gonna chest again. Let's go to the left, right? Good. And let's go to the left. She's like, no, thank you. So next what we're gonna do is we are gonna be checking cranial bones, cranial sutures, TMJ, and then any tongue ties. So I'm just gonna grab this right here. What's going on now? What's going on? So first thing, I'm just gonna be feeling the cranial sutures. Hers feel okay. So with this finger, I'm just gonna go inside her mouth. I'm gonna be feeling the space between her lip and her gums, making sure there's enough room there. I'm gonna be doing it on the bottom and on the top. You okay? So she feels good there. I'm gonna be seeing if she has a shallow, hard palate. Hers seems pretty good. What do you think? And then I'm gonna check her TMJ. So I'm gonna go back on the right side of her mouth to her lateral and medial pterygoid muscles. They're a little bit tight on that side, so I'm just gonna hold that. What do you think? Then we're gonna go to the other side. Yeah. Yeah. We're just gonna be holding this. Good. What do you think? I'm just gonna be feeling on the outside here. And I'm just gonna do one last thing. I'm just gonna be putting my finger on that hard palate, and then I'm just going to be tractioning up her forehead a little bit. There you go. Just to make sure that all of those sutures are moving evenly and in place. Good. What did we think? And that concludes the exam. And from here, I would just address any concerns that Mama has. And that's it. Thanks for watching. Yay! Yay!